Hi, I'm Maryland State Delegate Dr. Terri Hill, and I'm running for Congress. I am on the ballot in the May 14th Democratic primary to represent residents of Carroll, Howard, and Anne Arundel counties in Maryland's new Congressional 3rd District. Let me share a bit of my journey. I have lived in the district since 1969 when my family relocated to Columbia from Philadelphia after my father accepted a position at the Social Security Administration in Woodlawn. I'm a proud product of the Howard County Public Schools, having graduated from Wild Lake High School. I obtained my undergraduate degree in bioelectric engineering from Harvard University and then went on to receive my medical degree from Columbia University in New York. After completing my residency and fellowship training in plastic and reconstructive surgery, I returned home and, stepping out on faith, opened a solo private practice. And I have been providing medical and surgical services to the people of the mid-Maryland area for the last 30-some years. I come from a family where caring for others is the expectation, not an option. And I've always taken it as gospel that service is the price we pay for our time here on earth. So whether treating facial or hand trauma in the emergency room, burn patients, making house calls for the disabled or bedridden seniors, performing cancer reconstructive surgery, or treating facial fractures, congenital anomalies, or even providing cosmetic enhancements. Whether doing that or volunteering for missions overseas to perform cleft surgery, my professional work has always been more to me than a job. It has been a way of helping others. Now, as our politics began to shift, I felt called to do more. In believing that my skills and analytical approach to problem solving, my experiences in the community and with the patients and their families over decades, and my perspective would be valuable in the Maryland General Assembly, in 2014 I ran and won election to the House of Delegates, where I have been serving on the Health and Government Operations Committee since 2015. I'm running for Congress to bring a missing voice to Maryland's 10-person all-male delegation and to make sure that there is thoughtful consideration being taken in a Congress that frankly is broken. As a surgeon and small business owner with a clinical practice of more than 30 years, I am sensitive to how economic and health policy impacts families and communities. In fact, I'm sensitive to how all policy affects people in their day-to-day lives. And I think it's important that we do everything we can to enhance people's sense of safety and security. I built my career on listening to patient stories and had the privilege of being their advocate both as a physician and as a state delegate. Too often being the first or one of a few, I also know that representation matters, and especially in the halls of power, and that if you're not at the table, you're probably on the menu. So I will leverage my unique background, my scientific perspective, to address issues that advance federal policies that are rooted in science, facts, truth, and compassion. My approach is based on my training as an engineer, such that I look for root causes in order to find sustainable solutions. I'm tired of playing whack-a-mole. And of the 535 members of Congress, only 19 are doctors, and only 3 of those 19 are women. Now that's a problem. That means at a time when reproductive rights are at the tip of the attack on our democracy, when we're facing many of the greatest challenges to healthcare, challenges that impact already tenuous economies and families, when we're looking at longer ER wait times, less accessibility, and facing opioid addictions and mental health emergencies, this is a real problem that we don't have people who have the lived experience to help come up with the right solutions. We need more medical professionals to inform the discussion and help make thoughtful decisions. I've passed legislation to help patients get prescription drugs affordably and to increase their access to health care, quality health care. My advocacy has extended to the environment, to housing, to job security, to safety, to social justice as well, and into doing everything that we can to improve the lives of an underserved in our economy. Now, all that good work can be undone. Everything we've done in Maryland can be undone with a simple act of Congress, and I want to make sure that doesn't happen. So whatever the challenge, the issues, often complex, they demand thoughtful and informed debate. The issues we face are urgent, and I have the experience, the skills, and the passion to get things accomplished. So I'm Terri Hill, and I ask for your support. Vote for Terri Hill for Congress in the May 14th Democratic primary. Put this doctor in the House. and thank you.